This is the Man Up Podcast, the doctor's guide to men's health. Each week on our podcast, we interview the top specialists of the field on various topics in men's health. If you have questions that you are too afraid to ask, we have the answers. This week, our episode is titled Clearing the Air on Smoking, Vaping, and Marijuana's Impact on Men's Health. I'm Dr. Kevin Chun. I'm joined as always with my co-host, Dr. Justin Dubin. Justin, we've got an interesting topic today, don't we?
Oh, yeah. And I think this is a really cool topic because I think over generations, there's been a very interesting progression of the things that we're going to talk about. We're going to talk about smoking cigarettes, which, you know, our grandparents and some of our parents really had exposure to and didn't know anything was bad. You know, doctors were recommending cigarettes at one point, you know, the coolest or the smoothest cigarette. So we didn't know about these things. We didn't understand their addictive. Yeah. Right. Exactly. We had the Marlboro Man. And then we're progressing to this newer time, this newer generation where maybe people are smoking cigarettes less, still prevalent as we'll discuss, but now they're doing other things like vaping and marijuana is really starting to come on the scene. And these are questions that as doctors, I think every kind of doctor is getting these kinds of questions with regards to how these things may affect aspects of their life. Because as we're going to talk about, vaping's on the rise. Marijuana usage is still, you know, becoming more popular. Are these things bad? Are we going to be like narcs and snitches? I don't know. I think it's important to just inform people and let them make the decision. So that's what I think we're going to do today. I mean, Kevin, what do you think?
I think you're absolutely right. We have, you know, as medicine has, you know, gone over the years, we've got a lot of data on, you know, cigarettes and, you know, their causes of like cancer. So we have a good understanding that lung cancer, bladder cancer for us urologists, pancreatic cancer. But, you know, as we go on and all these new things come out, such as vaping and the marijuana and stuff, this is the stuff that is still a little bit unknown. So I hope we can try to address what we know and what the current literature is out there right now.
All right. And that is where we bring in our guest today, Dr. Rena Malik. She's the assistant professor and director of female pelvic medicine and reconstructive surgery at the University of Maryland. She also has an excellent YouTube channel that she does some really great work and informs a lot of people out there about these kinds of things. So thank you very much, Dr. Malik, for joining us.
Thank you guys so much for having me. I love your podcast. You guys do such a great job. So it's an honor to be here.
Thank you very much.
Very kind words.
Yeah. So, I mean, I guess, so everything we talked about already and everything we know about cigarettes, and we're going to start with cigarettes because I think this is probably the easiest topic to talk about. You know, despite everything we know about cigarettes, about tobacco and smoking cigarettes, how it can harm you, still, according to the CDC, in 2020, about 12% of adults over the age of 18 are still smoking cigarettes. And, you know, men out of this group are still more likely to smoke cigarettes. And my question is then to you, Dr. Malik, besides what we know about how smoking cigarettes can cause cancer, how else can it impact our health? And specifically when we're talking about men's health?
Well, I'll start off by just saying that smoking is probably the worst health habit you can pick up. So, you know, you've already touched on all the cancer, right? But that's, you know, that's something that's really far away. But I think for guys, for men in specifically is like, guess what? Smoking will affect your erections. And that's a big deal, right? So it can cause erectile dysfunction. And if you're trying to have a baby, it can make it harder for you. And so those are two things that are very, you know, very things that you will do in your lifetime. You're going to have sex and you're probably going to have babies. So really, if you are, you know, if you're smoking right now or thinking about smoking, stop. And we're going to talk a lot more about it, but I will just say it's the number one thing that you can easily not pick up in the first place.
So Dr. Malik, let's hone in on the first thing, sex. All right. So how do cigarettes cause erectile dysfunction?
Right. So cigarette smoking and the chemicals in cigarettes like nicotine and all these other horrible chemicals in cigarettes, they have a lot of different factors. But what they do is they cause blood vessels to narrow. They can cause inflammation and they can also cause plaque buildup. And all these things taken together essentially reduce blood flow. And for erections, as you guys well know, you need very good blood flow to the penis, right? And so when you develop these complications from smoking, it's going to be more likely that you're going to have issues with erections. And in study after study, we see that smokers are at higher risk, up to 3 times higher risk, depending on how long you smoked for, of getting erectile dysfunction.
Yeah, it's kind of scary. And when you think about smoking, it is a systematic effect. It affects every aspect of your body. And that inflammation causes injuries down the line. And if you really think about it, and this is what we talk about heart disease, we know heart disease is caused by smoking. Now, heart disease, one of the first signs of heart disease is what? Erectile dysfunction. So obviously, before you even have heart problems from smoking, something down there is not going to be working because the vessels are smaller and you're going to get, so they're more susceptible to injury. So absolutely, your penis is going to suffer much sooner than your heart is. So it's something to think about.
Now, on that note, so we've identified now the penis, it's getting affected. The penis is used for reproduction. So Dr. Malik, how does smoking impact the male fertility?
Yeah, so this is actually, sperm are the building blocks, right? You need sperm to have a baby. Yep. And sperm are created in the testicles. And you guys all know testicles are outside the body. So they're at a lower temperature because they need this really perfect environment to create sperm. And when you get chemicals in smoke, particularly like heavy metals like cadmium and lead, these can affect your ability to create sperm and the quality of sperm. You can also get damage from stress. Basically when you smoke, you get these things called reactive oxygen species, which create stress in that environment and make it harder for sperm to be produced. And so what it does in multiple studies, we've seen that it decreases sperm concentration, meaning you have less sperm per ejaculate. You're going to decrease the motility, meaning that sperm are not going to move as well. So they're not going to reach the egg as easily as they would. And, you're going to have maybe some damage in the DNA of the sperm. So all these things taken together can make it you have less high quality sperm, which means it's going to be less likely to have a viable pregnancy when you're trying to conceive.
I just think it's interesting, Kevin. Now, Dr. Malik mentioned all these chemicals like lead and I think you said cadmium. I don't even know what that is, but imagine just giving someone hey, you want some cadmium or some lead? No one's going to say yes.
Probably not good for you. Probably not good.
But somehow, people are able to bypass that when you're smoking a cigarette and you're smoking cadmium or lead. And if you say those things and you read what's actually in it, I think a lot of people may think twice or hopefully think twice.
Yeah, absolutely. I mean,
that's my 2 cents.
It's the whole advertising of smoking. They don't advertise, hey, you're inhaling cadmium or all that stuff. It's the smoking, unfortunately. So.
It's Joe Cool, Joe Camel, yeah. But that doesn't exist anymore. I think that dates us all. But so I think we're talking about stopping smoking and the risks of smoking. So obviously, if you're smoking, we want you to stop, and if you're not smoking, don't start. But for smokers out there, because we're still talking about almost 15% of the population of adults and more men than women. Can these things be reversed? Is it some people may say, oh, it's too late for me. I'm already smoking for 5 years, 10 years. Can these things be reversed?
Yeah, so it's never too late. Things even your taste buds can change after you quit smoking and as quickly as a week after smoking.
That's wild.
So for specifically for erectile function and fertility, if you think about sexual performance or erectile function, they've done studies on this and they found that somewhere between 3 and 6 months, people can have improved erectile function after they stop smoking. And so that's not a long time, right? 3 and 6 months,
no.
You can potentially have stronger erections. And it really depends on how long you smoked and how bad your erectile function was before you started. But ultimately, there's hope for you. So quitting anytime is going to be better than just continuing smoking and resigning yourself to living like that.
100%. Kevin, how long does it take for sperm to regenerate, right?
It takes a sperm cycle is 72 days. So you're looking at roughly close to about 3 months or so.
Correct. So, you stop smoking, within 3 months, you're already putting yourself at better odds of better sperm. right? So like you said, Dr. Malik, there is ample time. There's always time to quit. And so do it if you can.
It kind of goes along with like the same thing with, they say like your cancer risk, I got to go back to like my med school days, but I think it was like mid 30s. They were saying like, once you stop smoking, you stop then. Some of these things are reversible and you can kind of reduce the risk of cancer and kind of get yourself back to that norm level. But so just to summarize for our listeners, Dr. Malik gave us some great information. Look, smoking is bad, right? Smoking is, linked to erectile dysfunction. Smoking is linked to poor sperm health, right? And so, these are things if you're doing now, and if you're trying to have sex or you're trying to conceive, these are things you should probably stop, doing.
Absolutely.
But so on that note, so tobacco use, it's thankfully on the decline. For a lot of people, is replaced by now what's called vaping or e-cigarettes. So currently, the data suggests that 1 in 20 Americans use these e-cigarettes, and it's one of the more popular substances used by young people. Approximately 11% of high school students vape. So this is concerning.
Which is crazy. That's a huge number.
11%, right? That's
it's a lot.
So
we've seen it. We've seen it.
Yeah. So with this limited knowledge of vaping and its potential long-term effects, what do we know about vaping and its effect on health?
Yeah. So interestingly, I think it was a year ago, 2021, there was a study that came out that looked at this exact question. They looked at I think it was 20,000 patients, and they looked at how much they vaped based on reporting, right? And they found that people who vaped, when they controlled for everything, they didn't include people who had erectile dysfunction. They didn't include people who had high cholesterol, diabetes, obesity, heart disease, any of these factors that are associated with erectile dysfunction. In the beginning, they found that basically if you vaped, you were 2.5 times more likely to have erectile dysfunction than those who didn't. I mean, that's insane, right? 2.5 times. Yeah.
And what's scary is, like Kevin mentioned, is that people it's kind of like cigarettes back in the day, right? You see all these movies where the 13-year-old kids, the 15-year-old kids were smoking cigarettes because they thought it was cool. Now you're seeing all these kids in high school, 16-year-olds, all the jewels, and they're still smoking. So, these long-term effects, as we kind of mentioned with cigarettes, could potentially, the earlier you start, the longer you go, the more addicted you can be to things. It's harder to get off of it because there's still nicotine involved, and you're potentially increasing the time span for you to have an injury. Now, we talk about erectile dysfunction. It's very interesting because I think there are, that's a great study, which I actually wasn't even aware of. So that's awesome. But, there are more mouse studies and systematic reviews that do show similar injury to tissue of the penis like that in humans. They haven't done human studies, obviously, and because it's fairly new. But I find that really, really interesting. And it's kind of scary. I don't know. What do you guys think?
Yeah, I mean, I think we just don't know enough about how vaping is changing the chemicals, how the actual heating of the fluid or whatever that's in there is actually getting delivered to the body. And I think it's there's some positives, right? It's a good way to wean yourself potentially. I mean, that's what people say. Mm-hmm. But if you're using it every single day, just like you would smoke cigarettes, then you're going to have probably very similar, if not maybe worse, outcomes for health.
Yeah, I think there's such an assumption that these things are so much better than cigarettes. And we really don't know enough. I think you made a great point, Dr. Malik, about the weaning. I've seen some literature on it saying hey, this might be a way to get patients off the cigarette smoking and maybe move them off even just smoking in general. But, I think the point is that there's still a lot we don't know about this. We have no long-term studies on it.
Yeah, and it's also poorly regulated. Like you said, we don't know the chemicals exactly. I don't think they've done studies where they're looking at the concentrations of nicotine, of the other chemicals, and it's very inconsistent amongst companies and things like that. So, and I think that's one of the bigger problems. And you talk about popcorn lung and all those other things that is also controversial and associated with vaping. So, I think down the line, we're going to learn a lot more. But I think in general, when you're smoking something with random chemicals, probably not going to end up good for you at the end of the day.
Yeah, I actually know a guy who used to own a vaping store, and he used to like store the liquid in his garage. Like there was no regulation, right? Like I was like, you know, so I would just say like, you know, there's literally zero. I mean, there's starting to be more, I think, but in the beginning there was none. Like they didn't know what to do with vaping.
That's crazy.
In the garage.
Just like, let me just keep it all in the garage. That's awesome. Well, not really, but
not awesome.
Not awesome. Not awesome. Don't do that. Don't don't sell it from your garage. But now, so that's vaping, and obviously we there's not much data as we discussed, but now we're coming to kind of the big one, marijuana. You know, currently 18 states have legalized marijuana. And according to the CDC, almost 1 out of 5 Americans have used weed at least once in the last year. And marijuana is really interesting, really, because as we as a society are more open to its usage, we also medically have found ways in which we can actually help treat people, especially with specific health issues and potentially other diseases and disorders. So just in general, like, I mean, what ways do we know that marijuana has been helpful? Because, you know, we are pretty open here. I don't want to just bash something because we do know there are positive effects to it.
Yeah. So, I mean, it's been used in a lot of different areas of medicine now. It's been studied most commonly for pain disorders and cancer, and for appetite suppressants for people who have lost their appetite due to cancer therapies. But they're starting to study it for other things too, like glaucoma, multiple sclerosis, like neurologic disorders, things of that nature. I've personally seen some work on it for multiple sclerosis for urinary problems.
Oh, wow. That's cool.
And I think that there's probably some value in it potentially for overactive bladder, similarly, because there's these cannabinoid receptors in the bladder. But, you know, still remains to be studied. So we don't know.
So, you know, not to sound like a narc or a party pooper, but like any medication or medicine, there are possible side effects. So when it comes to marijuana in general, how can excessive use affect your health?
Well, you know, marijuana has positive effects and it has, you know, negative effects. Certainly it can affect, it's like normally used as a relaxant. And so it can make you more sleepy and less, you know, attentive to things that, you know, you're doing potentially, and it can obviously impair your judgment. So there's negative things about it as well. And, you know, some of them are, a big one that we often talk about is fertility. Like, how is it going to affect your fertility? And a lot of guys, if you look on Reddit, there's like whole pages about marijuana and how it affects sexual function. And so I think that, you know, there's certainly ways in which marijuana affects your body that, I mean, there's an addictive potential. I think the biggest one is that people do get addicted to its use and the feeling they get when they're using it.
100%. And I mean, I guess we can kind of go there. Let's start off with erectile dysfunction, because I think that, you know, it's interesting because I think the one problem in general, I guess before we talk about erectile dysfunction and its impact on health in general, is the one problem we have with marijuana, almost similar to vaping, but not the same level, is because it's not FDA or like federally legal, it's hard to really study this because you can ingest it, you can smoke it, you can
multiple forms.
There's so many ways forms of taking it. And it's hard to get an accurate dosage because, like, who's regulating it? So how are you comparing doses to another person? So it's very, very hard to do good, legitimate studies on this. So I think that that's kind of just important to
a good
put
disclaimer.
out there. But everything it's kind of a disclaimer because everything we're talking about is what we know or we try to know. And I think as it's becoming more accepted, we're going to be able to do better studies on it and have a better understanding. And they're doing some great work on monkeys right now, which we'll probably get to at some point. But when it comes to erectile dysfunction, I think in general, it's kind of like one of those things. I'm assuming like you're going to be smoking it. And I think the data has shown that it does cause erectile dysfunction. Is that correct, Dr. Malik?
Well, so it's interesting, actually. They think in the short term, maybe it doesn't, right?
Right.
Maybe it's going to increase your libido
Yeah.
because it increases sensation. And so you get you might get some benefit from it in the short term. But if you use it chronically, certainly there's data to suggest that perhaps it affects erectile function, right? So, and there's a couple different ways, right? One is that it can affect like the nervous system, the way the cannabinoid receptors, which marijuana acts on, can affect the way your body creates erections, essentially, to make it very simple. And so that can create issues with erections. Also, that increased sensitivity can cause premature ejaculation, which is undesirable, right? You don't want to ejaculate before you're ready.
Yeah, very undesirable.
Yeah. And then, you know, like I said, in the short term, it might increase your libido, but if you're using it all the time, you're going to get drowsy and like kind of less interested in things. And that can actually cause the worst problem, or the opposite is low libido.
Yeah. So, I think there's still, a lot of work that needs to be done in the area. It's still like, just like you said, Dr. Malik, short-term versus chronic use, still a lot of longitudinal data that we need. But let's go to the other aspect. So, just like we talked with cigarettes, fertility, men, I would say it, I'm sure Justin says it, we see a lot of patients, they come in and they say like, I don't smoke. I don't do any of that stuff. And then before they leave, they're like, oh, I forgot to say, actually, I smoke marijuana, but I don't, and it's a whole fertility visit. So, can you tell us what we know about how marijuana can impact male fertility?
Yeah, so there's been a lot of studies on this. And so there's pretty much evidence that shows marijuana affects the fertility pathway at many different areas. And you guys probably know this better than me, actually, but they've shown a reduction in sperm count, meaning how much sperm you have, the concentration of sperm in the ejaculate. So how much sperm is there per ejaculate, the shapes of the sperm, as well as the movement of the sperm after using marijuana. And so we know that affects the quality of the sperm and probably affects fertility as well. And so, as you guys have mentioned already, that very often this is something you guys talk about when you're counseling patients on fertility.
The thing is, I think the data shows that, just like you said, Dr. Malik, that there's a decrease in these sperm parameters. Interestingly, one of the studies that we heard about at a recent conference that me and Justin went to, up in Oregon, they're doing a study basically looking in, was it like Maccabee monkeys or something like that?
Macaw, not Maccabees. That's the Jews.
Excuse me. Sorry for all the Jews out there. But so they were looking at it. Basically, they saw testicular atrophy. They saw all sorts of stuff. They actually did not see any changes in sperm parameters, but testicular atrophy probably leads to, hypogonadism, and that has an effect on fertility. So I think there's a lot that still needs to be learned about this area, but, generally Justin, you can chime in after this, but, our recommendation is if you're trying to conceive, it's better to take this out of the equation and not be smoking marijuana. If you're not trying to conceive, it's a little bit more in the gray area, right, Justin?
Yeah, I totally agree. Listen, I don't know what the law is in Maryland. I know in Florida it's illegal, but here in Illinois, it's legal. And I would say a huge proportion of our patients are smoking marijuana. To what degree? Most of them are, maybe once, twice a week, which isn't heavy usage in my mind, or how I would define heavy usage. But, when we come in and they come in and we're counseling them for fertility concerns, I always say, and what we say here is, listen, if you're trying to optimize your fertility and give yourself the best shot, just cut it out for now. Listen, if you're not trying for fertility purposes, do whatever. I'm not gonna judge you.
You're not the narc or party pooper.
It's a conversation we can have. Right. I'm not the director. I'm not the party pooper. But if you are coming into me and you're asking for fertility questions or recommendations, we're going to recommend probably stopping marijuana. And I've seen it. I've seen guys come in, right? Like I've seen guys come in who smoked weed like 3 times a day, every day. They come back like 6 months later and they've stopped and their semen parameters have improved. Is that going to be everyone? I don't know. That's anecdotal. We still need to do more research. In general, I'm fine with it, but you got to know what you're getting into, right? When you're doing these.
Yeah, I completely agree, Justin. Completely agree. So, Dr. Malik, so what are your final thoughts? Let's start with marijuana. What are your final thoughts on marijuana in general in terms of health?
I agree with Justin. I think that like if you're doing it recreationally and you're getting benefit from it in whatever way, and you're responsible and you're safe and you're not trying to conceive, by all means, that's your choice. There are obviously risk factors because, as you guys mentioned very clearly, we don't know what they're mixing into it. You don't know, whatever, depending on who you buy it from, where you buy it from, there could be challenges or other things that come about. But ultimately, using it all the time, habitually, like regularly, I wouldn't recommend, because I just don't think that, even though the data is not entirely clear, because as you said, studying this is difficult. My guess is that if you're using it every day for years on years, it's going to create long-term problems.
I think that was well said. That was well said.
No, I think that's perfect. And I think that just some concluding comments, I think we can go around the room. But my thought is, listen, you're putting something in your body. I mean, it's very interesting. A lot of people always question medications that we give them, but sometimes don't question whether it's cigarettes, vaping, marijuana. But, it's also something to consider because these things do impact you, sometimes negatively, sometimes positively. There are positive effects to things like marijuana, but, we're here to educate you and come up with a plan together. And talking about it is important, and being honest with your doctor, because if you don't tell us, like kind of Kevin was alluding to, we're never going to be able to help you or give you an educational, give you your information on it so you can make the decision.
Yeah. Yeah, I mean, I think it's important to note that, like, with cigarettes, I think we have a lot of information on that. So we're very confident in our answers when we say that. With e-cigarettes and marijuana, it's a little bit more recent stuff. So, look, we're just trying to go through all the information's out there and just trying to get it to you guys so that way you understand, like, where things stand right now in the literature, and, on the marijuana thoughts that, there are some positive benefits to it, as it's been shown for medication for people who are on chemotherapy. There's a lot of benefits for that. But at the same time, depending on what you're coming in for, it could be causing some ED and it could be causing some impacts on your fertility. So those are my final thoughts.
Yeah, I agree with everything you guys said. I think, guys, if you are ready to quit smoking, if you are smoking already, please ask your doctor for help. There's actually data to suggest that if you get help, you're 4 times more likely to succeed in quitting. So there's medications, there's so much support out there, and you got to be ready in your head, and then you will be able to succeed, and we're here to help you. Most places will have access or know someone who runs a smoking cessation clinic who's an expert in this area that can help you.
That was perfect. That was excellent. That was excellent. So having said that, I think that was a great way to wrap up the episode. I want to thank Dr. Malik once again for coming on. Give us, where can everyone find you on YouTube, Instagram, Twitter? You're all over the place. Tell us.
Yeah, so you can put my name in, Rena Malik, MD. You'll find me on YouTube, Instagram, Twitter, TikTok, all the places. And hopefully you'll find some helpful information on my channel about men's health as well.
Dr. Malik,
check me out.
She's
you are
excellent.
An excellent communicator of medical information, I must say. You're excellent.
Thank you.
Yes, and we really enjoy your content. I know a lot of people do, so we're really honored to have you on. So thank you so much, and hopefully we'll have you on again at some point for sure.
Yeah, thanks guys so much. It was great.
All right, so for all our listeners, as always, you can check us out on our website. What's the website, Kevin?
www.themanuppod.com.
That's right. All of our podcast episodes are there, but you can also listen to us on any podcasting platform like Spotify, iTunes. You can download, subscribe, give us a review, 5 stars. Comment is always appreciated. You can find us on the Man Up Pod on TikTok, Instagram, Twitter. Please share, follow, retweet, comment, also there. For Kevin and Justin, thanks again for listening. Until next time, have a good one. Bye.